with the kind permission of Chair.
Yeah.
So we know, and ma'am has in the first presentation did explain the number of diabetic cases and even why the need for more and more understanding and studies around it. So the objective was to, because I'm going to talk from the nutritional perspective, the objective was to present unidentified and unmet needs when we talk about the nutrition. And here, in terms of protein and fiber, to evaluate the metabolic importance of macronutrient balance beyond only carbohydrate, whether we are restricting it or whether we are talking carb counting, and also about micronutrients, what else can we think of, and to have some clinical appraisal around the protein fiber ratios, as well as develop some expert consensus around it. So if we talk about the ICMR India based study, we see the prevalence of diabetes is only increasing. And if we look at the nutritional intake, of course, the protein population wise, we are just 12%. And even if we are more a vegetarian nation, the quality of protein is a question. So, and 1 in 10 are adults are suffering from type 2 diabetes, not to mention pre-diabetes, not to mention the postprandial glucose excursions, and also it is more an energy-based diet that we consume. The rationale was that the national data does show widespread low protein intake in Indian adults, as well as fiber below the recommended 40 grams, and it is pan-India, so there is no state that meets the standards. So there is a protein to fiber gap, and this gap is not just in the Indian continent, but of course pan-India. And here in India, we talk about fiber less than 20 grams per day, which is not even half of the daily uh, uh, recommendations. Also, understanding the evolving nature of fiber when we are talking about type 2 diabetes, when we are talking about metabolic issues, obesity is well defined. And the relationship between the fiber and the gut-brain axis. The recommendations of fiber are around 14 grams per 1000 kilocalories. That gives to around 28 to 40 grams of fiber per day. And we do not meet that. If we look at the role of protein in diabetes mellitus, the recommendations are around 15% to 20% of the total energy from protein, 0.8 to 0.9, and rather even 1 to 1.2 for muscle maintenance. When we talk about role of protein and weight management, definitely it does support in satiety. So nutrition probably needs certain ratios, and this was moving around from the concept of only carbohydrate and protein. We are talking ratios of maybe a balanced carbohydrate to fiber, a balanced protein to fiber ratio that could support management. So the 6M classification of nutrients, which is the mega, the macro, meso, microbiome, and also anti-nutrients that come when we in way of cooking. The mesonutrients, the fiber and water, somewhere are not spoken about so much when we are concentrating only on the macro and the micro, and that's where our thought process to bring in the consensus came forth. So the ICMR 2018 guidelines does say that it should be in the ratio of 2:1, the protein fiber ratio. And the methodology was that 2 multidisciplinary expert meetings were conducted, 30 clinicians from Pan India, dietetic, also diabetologists as well as endocrinologists were a part of it. We reviewed more than 132 scientific papers to have 11 scientific statements that were formed, and on 5-point Likert scale, this was identified. And all these statements were then reviewed, and what we found is that protein to fiber intake remains suboptimal, not just the intake, but even the ratios remain suboptimal. We could have a consensus for more than 96.3%. Even diabetes protein does help in maintenance of lean body mass, and also could help in as maybe as terms of supplements and as partial meal replacement, could also be a part of the meal between the lunch and the dinner. So the recommendations were that these ratios could support reduced postprandial excursions, low glycemic variability where there was 100% consensus, improved satiety, improved appetite, and thereby facilitating weight loss, thereby preserving the lean body mass as well as glycemic excursions. So 11 of the 11 statements did meet the predefined consensus of more than 80% agreement, and the consensus were of more than 4 on the Likert scale. So the results showed that around 96% of the experts after the review of papers showed that habitual diets are substantially deficient in both protein and fiber, and that recommendation is not just improve only the protein as one of the macronutrient or improve only the fiber in case of gut issue, but maybe this ratio could be one of the ways we define the treatment and one of the ways we define the nutritional management. So the fiber and protein importance was identified in more than 90% of the experts for glycemic control, improved glycemic variability, satiety, and weight management. We could optimize it with MNT. So to conclude, a paradigm shift could be a way forward rather than only carbohydrate restriction. Partial meal replacements could support weight management. Protein fiber optimized MNT could be a way forward. And the most important was 2:1 protein to fiber ratio is ideal as per even ICMR guidelines. These are the references. Thank you.